A nurse attends to medical equipment at the Orange County Children's Hospital in Orange, California. By ripping out a major component of President Barack Obama's health law, Republicans could claim at least a partial victory on an issue that has stymied them all year. Mike Blake, Reuters, Washington. The House's leading tax writer on Friday opened the possibility that Congress' push to cut taxes could mesh with its so-far failed effort to repeal the Affordable Care Act, saying the tax bill could include a measure to do away with the health law's mandate that most Americans have health coverage or pay a penalty. Representative Kevin Brady of Texas, the chairman of the House Ways and Means Committee, said no decision had been made about whether to include repeal of the so-called individual mandate. But he said President Trump wants its inclusion, and he indicated that Republicans wanted to evaluate the fiscal effects of taking that step. Meanwhile, an independent analysis of the bill from the Tax Foundation found that the draft legislation would cost too much to survive the budgetary requirements needed to pass the Senate on a party-line vote, a sign that Republicans will almost certainly need to rework it in order to keep their hopes alive for delivering a bill to President Trump's desk by December. The analysis found that the bill would add $2 trillion to the federal budget deficit over the next decade, an amount that shrinks to $1 trillion even when additional economic growth effects from the bill are factored in. This does not pay for itself, said Scott Greenberg, a senior analyst at the Tax Foundation. The bill would continue to add to deficits after 10 years, violating the procedural budget rules that Republicans are hoping to use to avoid a Democratic filibuster in the Senate. The White House is projecting robust economic growth from the tax cut, and the analysis found that, if those growth projections hold, the bill would create an additional 1 million jobs and raise incomes for rich, poor and middle-class Americans. If those growth projections fail to materialize, the top 1% of earners would see income gains twice as large as those seen by middle-class workers. When economic growth is taken into account, the gains would be more evenly distributed, with the middle class seeing the biggest income increase on a percentage basis. That is because the Tax Foundation assumes additional growth spurred by business tax cuts largely finds its way into workers' paychecks. The Republican effort to pass a tax bill has been bedeviled by a math problem, as lawmakers struggle to find enough revenue to offset the corporate and individual tax cuts they envision. The president feels very strongly about including this at some step before the final process, Mr. Brady said Friday at an event hosted by Politico, adding that there were pros and cons to repealing the mandate as part of the tax overhaul. Repealing the individual mandate could help Republicans pay for their tax bill, which can add no more than $1.5 trillion to federal budget deficits over a decade. The Congressional Budget Office said last year that eliminating the mandate would reduce deficits by a total of $416 billion by 2026, since fewer Americans would obtain insurance that is subsidized by the government. At the same time, the Budget Office said that such a step would increase the number of people who are uninsured by 15 million in 2026. Premiums for people buying insurance would increase by about 20%, the Budget Office projected, because people who are younger and healthier would be more inclined to go without coverage. Republicans are looking for other ways to squeeze more dollars out of the tax bill. On Friday, Mr. Brady released an amended version of the tax bill that will reduce the value of the income tax cuts for individuals by $90 billion over the course of a decade and slightly shrink the estimated cost of the legislation. The amended bill includes a technical change that immediately adopts a revised measure of inflation, known as chained CPI, which would change how inflation is calculated, thus slowing the speed at which tax brackets grow with inflation. As a result, Americans would more quickly find themselves in higher marginal tax brackets, jumping from a 12% top bracket to 25%, for example, as their incomes increase. The chained measure would also slow the value growth of some inflation-adjusted tax benefits, such as the Earned Income Tax Credit. Getting rid of the individual mandate has been a core component of Republican proposals to dismantle major parts of the Affordable Care Act, a goal that remains unfulfilled after the Senate was unable to assemble the votes to pass the repeal measure this year. Congressional Republicans have now turned their focus from healthcare to taxes, and House Republicans on Thursday unveiled a sweeping tax proposal that party leaders hope to pass through the chamber by Thanksgiving. On Monday, the Ways and Means Committee plans to begin several days of formal bill drafting sessions, and the panel could approve the tax legislation toward the end of the week. The Senate has been working on its own tax bill, which, like the House bill, is based on a framework that was put together by the two chambers and the Trump administration. Senator Orrin G. Hatch of Utah, the chairman of the Finance Committee, plans to unveil the Senate's tax bill after the House Ways and Means Committee has approved its own proposal. If both the House and Senate can pass their own tax bills, the two chambers would then be faced with ironing out the differences and coming to an agreement on a final tax bill. Adding the repeal of the individual mandate to the tax overhaul is an alluring but risky move for Republicans, who are still smarting from their failure to fulfill their promise to voters that they would repeal and replace the Affordable Care Act. By ripping out a major component of President Barack Obama's health law, Republicans could claim at least a partial victory on an issue that has stymied them all year. Mr. Trump has already declared his support for the idea, writing on Twitter this week, "It'd be great to repeal the very unfair and unpopular individual mandate in Obamacare and use those savings for further tax cuts." Donald J. Trump at Real Donald Trump, November 1, 2017. For the middle class, the House and Senate should consider ASAP as the process of final approval moves along. Push biggest tax cuts ever. Donald J. Trump at Real Donald Trump, November 1, 2017. Senator Tom Cotton, Republican of Arkansas, has been arguing for the mandate to be included in the tax overhaul. The savings that would be realized by repealing the mandate, he says, would help with the tax effort. "I think it's a pretty reasonable proposal to repeal the most hated part of Obamacare to help pay for tax cuts the American people want," he said this week, rather than trying to eliminate popular, widely used deductions and credits, exemptions, and exclusions, but injecting the delicate politics of health care into discussions about a tax overhaul could make an enormously difficult legislative task even harder, especially in the Senate. "The attitude is, let's not mix up healthcare with this, that it could cost you votes, and we're not trying to do that," said Representative Tom Cole, Republican of Oklahoma, who described himself as agnostic on whether the individual mandate should be added. He said the issue, like others, would come down to basic calculation: does it add votes or does it take votes away? Mr. Brady had previously expressed wariness about adding the mandate to the tax overhaul, and he offered a similar caution on Friday. Importing healthcare into a tax reform debate has consequences, especially one where the Senate has yet to produce 50 votes on anything related to healthcare that I'm aware of, Mr. Brady said. Reigniting the debate over healthcare would also give Democrats a new line of attack as they try to rally the public against the Republican tax bill. The House Democratic leader, Nancy Pelosi of California, offered a warning on Friday against what she described as chaining the GOP tax hike on millions of middle-class families to the failed zombie of Trump care's lethal health cost increases and explosive coverage losses. Republicans should seek treatment for their obsession with repealing the Affordable Care Act and raising Americans' health costs before they make a terrible tax bill downright deadly, Ms. Pelosi said.